This is the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me on the program today is Dr. Lakshmi Lal, the Director of the Non-Communicable Diseases Program at the Ministry of Health. Today we'll be talking about the recently launched cervical cancer screening program. Welcome to the program, Dr. Lal.
Thank you, Alicia.
So today we're talking about the cervical cancer voucher program recently launched in the month of June. And with cervical cancer in Guyana as the second leading cause of cancer-related deaths among women, could you tell us how important is early screening?
So firstly, early screening is what will allow us to detect changes on the cervix in all women between the ages of 21 to 65. Cervical cancer of itself doesn't show a lot of symptoms until it gets to an advanced stage. We need to be able to examine women earlier so that we are able to find those changes as they happen at the level of the cervix, to quickly intervene and to provide management going forward for women.
Definitely, and I know the government of Guyana has made this process much more easier with this voucher program. Tell us about that. Who is eligible for this?
Okay, so the ambitious plan is to screen at least 70% of our women between the ages of 21 to 65. Of course, Guyana can go past the 70%. We want to ensure that we are screening the approximate of 211,000 women from now to 2024. The government of Ghana has provided a voucher at the cost of $8,000 that pays for an HPV test. That test, the voucher is redeemable at 5 different locations, and those locations are listed at the back of the voucher. Women may choose to do one of two things. Either you can take the voucher to your nearest healthcare facility, and you can have the sample taken off, and that voucher is attached to the sample and it's sent to the testing facility. Or women can enter the facilities directly and have their samples taken off, and the results will be provided to them in the matter of 3 to 4 days. 3 to 4 working days.
Quite simple, Dr. Lal. What can women expect when they visit a health facility to get this test done? I know a lot of women are a bit skeptical about even going and get tested, going and get screened. They're not sure what the results might be. Yes. And so some of them are skeptical. What can they expect?
So when healthcare workers visit the health facilities, they will be asked to do a vaginal inspection. A speculum is inserted into the vagina for us to be able to see the cervix, and a swab is inserted just to take a little bit of a sample from around that cervical area, and it's placed into a tube and that is sent to the lab. So there's no injection that is involved. No one is retracting any piece of tissue. It's a simple swab.
So the woman might just feel a little bit of discomfort.
Correct.
And that's just about it.
Correct.
What are the next steps? Let's say a woman tests positive or negative. What happens next?
So for all women who test negative, they are asked to repeat the test in 5 years. For women who are positive, the next step is for us to re-examine the vagina, re-examine the cervix, the mouth of the cervix, and that is done with either one of two things, a VIA test, or we can do a pap smear. If those tests indicate any changes, the presence of any cancerous cells at the level of the cervix, the woman is then sent to do what's called a cryotherapy procedure. Cryotherapy is a procedure where we basically freeze the cells at the level of the mouth of the cervix, and those are removed. For any cancerous cells that we find ascending higher than the mouth of the cervix, the woman is then sent to do a LEAP procedure, and that is done by an OBGYN specialist.
Thank you, Dr. La. Let's talk a little bit about the strains of HPV. Tell us about that.
Okay, so HPV, there are multiple strains, maybe over 100 different strains. However, there are what we call the high-risk strains. Those are the ones that cause changes at the level of the cervix. And mainly those strains are 16 and 18. And we do have a few more between 31, 33, 39, 45, 51, 52, 56, 58, wow. 59. 66 and 68. And those are the strains that we are on the lookout for. If we find that in a woman, then that is someone that we have to follow closely in the clinic. She, of course, following the algorithm that we have, is then sent, like I mentioned before, to do the VIA test or to do the pap smear. And then we, between the OBGYN specialist and the local VIA provider, we then decide a plan of how we're going to move her through the services and to ensure that she gets the frequent follow-up that she has. So any changes that we detect on the cervix, it's detected early and intervention is done for her.
Definitely. And this provides a great advantage for women because they can know early what's happening. So
Correct.
prevention can be done. Is it possible for women to have other strains of HPV, but not the ones that causes cervical cancer?
Yes. And in fact, almost all patients, male and females, can have other strains of HPV. And those they will reside in the body, but they are not linked. They're not high-risk strains that are linked to causing cancer. For women who were screened, once you get those results, we advise you to ensure that if you choose to stay with the private provider, that discussions are done on how your next steps, how you'll be managed going forward. But we know that for the majority of the patients, we want to encourage you that you go back to your local healthcare facility, that the discussion is done with a physician or the VIA nurse at that center, so that the next steps is decided for you. It's not just for you to do the test and then we just leave it in the air. We want to ensure that followed up intervention happens.
Thank you, Dr. Lal.
Hello? Yeah, gal, me there walk, gal. Yeah, credit their house, you know, you does, gal, is a lime, by lazy bad. Hey, me was to ask you, you been and get screened for the cervical cancer thing? Where we can gone yet? Money, but gal, Ministry of Health give out one $8,000 voucher. Must go and collect them and go and get yourself screened. Good, go along and do IDs is really take things for granted, you know. And IDs too, watch there. IDs go along, make case and go and get screened. This cervical cancer thing is serious. I hear that from radical self. Early detection save lives. Make case.
Cervical cancer is on the rise in Guyana. It's the second highest cancer affecting women in our country. I wouldn't wish cancer on anyone. As a cancer survivor myself, I know how hard it is to battle cancer. And only recently, one of my family members, very close to me, came down with cervical cancer. Oh, how I wish that she had got tested before so that we would get an early diagnosis. So I'm asking you, please get tested. Please do your VIA, do your pap smear, and also get your children vaccinated. HPV vaccination works. It will save them from getting cancer in their later years. So please join this fight. Ensure you do the right thing so that you wouldn't have to worry like I had to.
Welcome back to the program. For those of you who've just tuned in, today we're talking about the Cervical Cancer Voucher Program, an initiative by the government of Guyana. Dr. Lal, for those persons who've just joined the program, could you tell us what is cervical cancer? What do persons need to know about this disease?
So cervical cancer, it's pretty simple. It's the expression of cancerous cells at the level of the cervix, at the mouth of the cervix. So what we'll call in local terms the mouth of the womb. And once we see those changes, cervical cells, once we see cancerous cells at the level of the cervix, we know that it has the potential to ascend eventually up to the cervix, and then it goes on to causing full-blown cancer.
Could you identify some of the risk factors that may cause cervical cancer in future?
So firstly, and more important, it's exposure to the human papillomavirus. Having had the human papillomavirus in the body, being exposed. Second is sexual history of having multiple partners, and that, of course, increases your exposure to STDs. The habit of smoking also can cause cervical cancer. As you know, smoking can cause a variety of
Yes.
cancers in the body. It's also having a weakened immune system as well. Having multiple infections with STDs, like I mentioned, chlamydia, etc. There is also some risk involved with long-term use of oral contraceptives. Having becoming pregnant at an early age, and also having multiple pregnancies. All of these can contribute to cervical cancer in the females.
Wow, and for different women, it occurs differently.
Correct.
What are some of the early signs and symptoms that women might see? I know some women would have mentioned that they saw abnormal vaginal bleeding while they didn't saw another sign. How does this work?
So, like with all types of cancers, initially you will not feel any pain. But as cancer progresses, as it moves from stage 2 to 3, the normal symptoms is that you'll start to feel weak, you'll feel tired. Women will start to see abnormal discharges coming from the vagina, pain in the lower abdominal region. That's not resolved at most times, but the most calling sign is seeing discharges, abnormal discharges coming from the vagina, which more than likely will prompt women to want to get an examination. And though this bleeding happens outside of your normal menstrual cycle. So that is what is alarming to women. That's one of the first calling signs.
Definitely. And since we're stressing prevention today, we want to get back to screening, that term screening. What should women do if they think that they might have cancer?
So it's firstly to get to a healthcare provider. Do not wait. Get to your closest healthcare provider. Express what is happening to that provider so that we can decide the next steps. And one of the first things, of course, is that we're going to send you to do an HPV test. We're going to do an examination of the cervix to ensure that we're not seeing any changes. So the first thing, and I advise all women, any changes, make sure you get to a healthcare provider immediately. Do not wait.
Definitely. And a VIA exam can be done across all regions at all health centers. I know many persons resort to traditional methods of taking care of themselves, their health, and so on. But definitely we encourage persons to visit their health centers and get screened early.
So to aid with this entire initiative that we have to screen 211,000 women, what we did is we had all of our experts, our local experts, they sat and they came up with a very simple screening algorithm that also involves treatment. So once cancer is detected, that goes beyond the interventions of having a simple cryotherapy procedure or LEAP. Once we see that cancer is more advanced, those patients are referred to the Georgetown Public Hospital. The case is then discussed between the OBGYN and the oncology department to ensure what the next steps will be for the patient. Would she be able to go to chemotherapy? Will she require any surgical procedure at that point? And then also if she requires radiotherapy and brachytherapy services.
Definitely. And I know the Ministry of Health has had quite a lot of success stories in terms of treatment to cervical cancer especially.
Yes. I just want to ensure the public that treatment is available, help is available. Cervical cancer is we are fortunate that cervical cancer is one of those cancers that can be completely eliminated from any society. And we want that to happen for Ghana. This is why we're actively we're going after screening for women, because we don't want our women to die from cervical cancer. It doesn't have to be like that. Treatment is available, early screening is available, and we just want women to access the service. If you are apprehensive of doing it alone, we ask that you ask one of your friends. You can book the test together. You can go in, have your examination. You can do your test together. But however you choose to do it, please get screened early.
Definitely. And you need to get those vouchers from your health centers, your health facilities nearest to you. So the Ministry of Health has an ongoing vaccination program, especially on HPV. Tell us about that. I know it has been extended to women up to age 45 years of age, and also men can get vaccinated as well.
Correct. As part of the elimination of cervical cancer strategy, the first pillar is to ensure that 90% of our boys and girls between the ages of 9 to 15 are vaccinated with the HPV vaccine, fully vaccinated. But Guyana has also taken it one step forward, in which we're offering that vaccine to persons between the ages of 16 to 45.
I am Lieutenant Colonel Dr. Latoya Lewis Frank. I am the Force Medical Officer. By specialty, I am a general surgeon. I'm happy that we can facilitate the screening of our women, and as the Force Medical Officer, it was my duty to ensure that all our women benefit. We not only have women who are military ranks, but we have our civilian staff as well. So they were all encouraged, because we know that early detection can lead to early intervention and eventually save a life. But I would like to take this opportunity to encourage all the women of Guyana, our mothers, our aunties, our nieces, our daughters, to get screened.
Cervical cancer is a cancer that is preventable. I think when people think about cancers, very often in their mind they feel that this is perhaps a natural outcome. But cervical cancer is one of those cancers. If we have the right interventions, we can actually prevent it from happening to a person. And so that is the aim of this program. The government of Guyana and His Excellency has a very special interest in this particular program. And in fact, for this program, we have designated $2.8 billion in this year's budget. And what it is that we're trying to do, if we're going to have a very comprehensive program, we have to think about it in 3 phases. So the first phase is really when you can do vaccination as to prevent people from getting HPV. And so we have started by targeting children, both male and female, between 9 and 15 years of age. And we want to achieve that World Health Organization number of getting to 90%. But we are convinced, and when you look at the latest guidelines from around the world, especially the developed countries, those guidelines are saying to us that we can go beyond ages 50 and give the vaccine to older women. And so for the first time in Guyana, we have extended the vaccination beyond 50. So we are now, in addition to the 9 to 15, we are now able to give women from 16 all the way up to 45 this vaccine. And so this is now available at our health centers across the country. And we hope that you would encourage women to make sure they come and get the HPV vaccination. But we also know that while some people would be vaccinated, there are many others in our population who have not been vaccinated. And traditionally, we were doing VIA. That's one of the tests that we've been doing. And we've been doing pap smears. But now we want to add to the screening methods that we have available in Guyana, HPV testing. Now, for a long time, HPV testing was not available in the public sector. It was only available in the private sector. And for most people, when we talked to them, they were saying to us that it's very expensive and they cannot afford to do the tests in the private sector. So we came up with a solution where the government would be paying for these tests, and we have the capability of doing it both in the private and public sector. So we want to use all the capacity that we have in the country to make sure that we can get a faster turnaround time on the tests. So once you do the tests and that is sent to the lab, we should get a fast turnaround time, at least within 96 hours. We should know your results. Now, for some countries, they have varying age that you can do this test, and we decided that we want to make sure that our population, between the ages of 21 years of age to 65, can have access to these tests. And we have a whole protocol that we have developed so that if you test positive, what would be the next steps? And so we have set up, before launching this program, we have set up a very elaborate system where we would know once somebody tested positive, we'll know the results, and then we can bring that person in and talk to them about what would be the next steps. Now, why is this screening important? You heard from Dr. Sukraj telling you that we need to screen so that we can detect early. In the very early stages, if we see any changes on the cervix, then we can, at that early stage, make certain interventions that would prevent cancer from happening. But what is happening now is that people come in when it's very late. And in some cases, they already have metastasis, which means that other organs of the body is affected. At that stage, it's very late. And so there's not much that we can do. Now, we want to make sure that we detect very early and we intervene very early. And once we intervene early, the survivability would be much, much, much more increased. And that is the trust of this program. We want to make sure that we detect early, and if we find any problem, that we're able to fix the problem early. And so we believe that following the science, that we would be able to reduce cervical cancer in Guyana to very negligible numbers going forward in the future. But what we need to do is to make sure that we have good coverage of the HPV vaccine. So we must make sure, and we have to talk to our kids, talk to everyone within that age group. So first of all the school-age kids between 9 and 15, boys and girls, because while the target here, or the focus here has been cervical cancer, there are other cancers in boys that can be prevented with HPV vaccines. And that is why that is important that both boys and girls receive the vaccines. So I think if we keep talking and encouraging children to be vaccinated and educating parents and people in our communities, we can see those numbers going up. And we want to hit that 90% mark. And then, while we're doing that, we have set ourselves a different standard. I think we are one of the very few countries in the Caribbean that is now offering the vaccines to women beyond ages 15. So between 16 and 45, for the first time, Guyana is now offering these vaccines, and we're one of the very few countries in the Caribbean that is doing so.
I think it's a good initiative. I encourage all women in Guyana to be tested because early detection saves lives. So, Dr. Lal, what would be your final words of encouragement to our listening and viewing audience?
So for all of our women between the ages of 21 to 65, this program is very important, and it was designed with you in mind. We want our women to be screened. We want women to be healthy. We want them to lead productive lives. And this is a golden opportunity. This is the first of the time that we're offering vouchers for women to be screened. And the process is so simple that you just need to get yourself a voucher. And that automatically ensures that you have access to screening. We want you to pick up those vouchers and you choose. You can go to your local healthcare facility or you can go directly to the testing facilities. However you do it, just please do it. Go by yourself, take a friend, take your mom, take anyone who is between the ages of 21 to 65 with you and get screened. We want to see our women live healthy, productive lives.
Thank you for joining me in the program today, Dr. Lal.
Thank you, Alicia.
Thank you for staying tuned with us. I'm Alicia Martin saying goodbye for now.